Hi everyone, I am Jailer G. Baguio and I will be discussing the school health services. So what is school health services? School health services refers to need-based comprehensive services rendered to pupils, teacher, and other personnel in the school to promote, to protect their health, prevent and control disease, and maintain their health. Basically, health services are provided for all the students and the school staffs to appraise, protect, and promote health. These services include assessment, planning, coordination of services, and direct care for all the children in the school, including those with special healthcare needs. This is also designed and coordinated with the community healthcare professionals to ensure early intervention, access and referral to primary healthcare services, faster appropriate use of primary healthcare services. Also, it prevent and control communicable disease and other health problems, and provide emergency care for student and staff for illness for and staff who has illness or injury, as well as to provide daily and continuous services for children with special healthcare needs and provide optimum sanitary conditions for a safety school facility and school environment and educational counseling opportunities for promoting and maintaining individual, family, and community health. So these health services are provided and supervised by the qualified professionals such as the physicians, school health nurses, dentists, psychiatrists, psychologists, health educators, registered dietitians, school counselors, and other allied health personnel provided these services. So, what are the aspects of the school health services? According to my research, there are 12 aspects of school health services. The following are: first, the health appraisal of school children and personnel. So, this refers to a series of procedures to assess or determine the health status of the students through the use of the teacher's observations, screening tests, health histories or inventories, medical and dental inspection, and psychological tests. The second one is the remedial measures and follow-up. So medical examinations of the students or the school personnel are not an end for them, but they need to be followed by appropriate treatment and follow-up by the qualified professionals I mentioned earlier. The third one is the prevention of the communicable diseases. So the communicable diseases can be prevented through the immunization because it is the most emphasized in functional school health service. The fourth one is the healthful school environment. So the healthy school environment component relates to the quality of the physical and aesthetic surroundings, the psychosocial climate, safety and culture of the school safety and emergency plans, and the periodic review and testing of the factors and conditions that influence the environment. The fifth one is the nutritional services. A child who is physically weak will be mentally weak. So the students cannot be expected to take full advantages of schooling. Therefore, the diet should contain all the nutrient in proper proportion, adequate for the maintenance of the optimum health. Example for this is the midday school meals, feedings, applied nutrition program, and many more. The sixth is the first aid and emergency care. So, the first aid and emergency care to pupils who become sick or injured on school premises rests with the teacher, and therefore, all teachers should receive adequate training during teacher training program or in-service training program to prepare them to carry out this obligation. Next is the mental health. Health services should provide, sustain, and support the mental health of the student as it affects their physical health and the learning process, acquiring of the lessons and other academic activities. Next is the dental health. So in schooling, dental related illnesses can really affect the learning process of the students. So the school health program should provide provision for dental examination to the students or even the staff regularly. Next is the eye health. The school should be responsible for the early detection of refractive error, treatment of the eye infections. In this case, administration of vitamin A to children at risk has shown gratifying results. Next is the health education. The most important element of the school health program is health education. The goal of the health education are to bring about desirable changes in the health knowledge, attitude, in practice, and not merely to teach the children a set, a set of rules of hygiene. Health education in school should cover the following area: the personal hygiene, environmental hygiene, and the family life. Next is the education of handicap. In this case, the ultimate goal of the health services is to assist the handicapped child and his family so that the child will be able to reach his maximum potential. Also, health services help to lead as normal a life as possible to this kind of students. Al- Also to help them become as an independent, productive, and self-supporting member of the school or the society. And last but not the least is the proper maintenance and use of school health records. In this aspect, a cumulative health record of each student should be maintained. Such records should contain their personal data, like their names, date of birth, parents' name, address, and etc. Also including their past health history, and also record of finding a physical examination and screening tests and record of service provided. So the purpose of having this is to maintain a cumulative information on the health aspect of the school children. Also, to analyze and evaluate the school health program and providing a useful link between the home, school, and community. That's all for the school health services. And I hope you learned something today. Thank you and happy learning, everyone.